Hello and welcome to another Facebook Live update about COVID-19 right here in Berrien County. For those of you who are joining us today, we appreciate you tuning in. My name is Jillian Conrad and I am with the Berrien County Health Department. And I am here today with Dr. Loren Hamel from Spectrum Health Lakeland, as well as our newer medical director, Dr. Rex Cabaltica from the Health Department. So thank you both so much for being here. We've got a lot to get to. We've had a lot of updates about COVID-19, case rates, vaccines, lots to get to today. So we will jump right in. And Dr. Cabaltica, I will start with you. Just a question about what we're seeing over the last couple of weeks. We know we've seen some case rates increase. The percent of positive tests are increasing. Help us understand what we're seeing in those trends, as well as what we are categorizing our trends as. We've thrown out a lot of figures about being in high transmission according to the CDC. Can you help break all that down for us?
So thank you, Jillian, for having me here. There's a couple of indicators that are being used by the CDC as primary markers that they'll be categorizing which recommendations for each community to go through. So the first one is the cumulative number of cases in the past 7 days per 100,000 to try to even that out over sparsely populated versus very densely populated areas of the country, as well as percent positive diagnostic tests. And those are primarily the nucleic acid amplification tests over the preceding days. They want just a good trend over the day, not over the week, not day by day. And so where we are here in Berrien County currently is on a steep rise, unfortunately. There are 4 categories that they will break that down into, from low, which is where we were in the very beginning of July, to moderate transmission, to substantial, and on up to high transmission. High transmission is where there's more than 10% positivity among those tests. We're currently at 11.5%. And for high community communication, that's greater than 100 cases per week per 100,000. We're sitting at well into that at 145. So we're on a steep rise, and that's really concerning. So we're working hard here at the health department to know how to answer that, how to meet that challenge. So why are we back in this situation? It's primarily the Delta variant, which is probably twice as infectious, as well as a combination of that with just the relaxing of a lot of the mitigation measures we had before. The masking was no longer mandated until a couple months ago by the CDC, as well as just a more relaxed attitude. We all thought that we were out of this, but we're seeing that even with the rise in vaccinations, we're not quite out of the woods. So we're trying to provide guidance to our community just to focus on those 2 factors, so that we have a roadmap for the national response that can be applied here in our local circumstances. So one thing in that, it would be very helpful that as we try to track down these cases, as we try to cut down this transmission within the community, that our contact tracers, we're ramping up our workforce there, but we need for our community to be able to answer those questions as thoroughly as possible, because that'll help us to try to flatten the curve once more.
Certainly. And in addition to those case rates and the percent positivity, our vaccination rates, we're also looking at hospitalizations. That's an important factor that we're considering when making that guidance. Dr. Hamel, tell us, how's it going there at Spectrum Health Lakeland?
Yeah, thanks for the question, Julian. So I certainly completely agree with what Dr. Cabaltica was saying. Our transmission is up tenfold over a month. Our hospitalizations are up 4-fold over the last month. And that's not a surprise. Typically, the hospitalization rate lags a bit. We've been here before. We were here in November. We were here in April. We're now on a steep increase in cases, and we expect a steep increase in hospitalizations a few weeks later. We have about 16 in the hospital. They're sick. They're somewhat younger than previous inpatient populations, and of course that's a concern. And they're almost entirely the unvaccinated. You know, your protection, if you've had a vaccination, even against this Delta strain, will lower your risk for hospitalization and death up to 25 times less. That's a pretty significant reduction. And so we're seeing that in our own admissions, very few sick enough that have already been immunized to be admitted. And across the country, of course, very few that have died, although it is reported. The protection is not perfect, and we knew that going in.
Definitely. So we know that that is certainly a concern. And with many of those younger people being children who yet are not able to be vaccinated, and school is starting back up again here in Berrien County, Dr. Cabaltica, can you please just help us understand what else are our recommendations at this time for preventing further spread of COVID-19, specifically in our schools?
So we've been working very closely with school superintendents. Courtney Davis has been just very active in trying to keep them informed on what the community transmission rates and positivity rates are, and laying out a very detailed and measured response. We don't want to just jump ahead of the game and try to put in measures that are not yet warranted, but we find ourselves right at the very top of that, top of those recommendations at this point. So layers of mitigation were what we're encouraging schools to do where possible. Making sure that there's cohorting and there's social distancing. If possible, if they can keep a distance of at least 3 feet between students. The next layer after that was the mask. We did not want to do that until the very highest, substantial into high transmission, unfortunately, are there right now. And perhaps the most important measure would be the vaccinations. Kids 12 and older, we have the EUA for Pfizer at least to be able to be given to those kids. So we would highly encourage you to get those kids vaccinated. And for those that are 16, are older than 16 years old, we've just gotten the great news that that it's finally been fully approved by the CDC. So and obviously the other measures that we've always done in times past, hand washing, cleaning and disinfecting, for those contact areas. So, but especially to protect the kids that are still younger than 12 years old. It's important that we do all of these measures. And for 12 years old and younger, masking is going to be key. And ideally, because schools are not really split up between necessarily grade 6 and below and grade 7 and above, that may mean that the whole school system needs to mask. And so we want to be very measured and help our school partners to make those decisions wisely.
Dr. Hamel, anything to add in that regard?
Yeah, I would just tell you from a health system, we believe in masks. You can find data in the literature that says these don't work as well as we thought. You can also find a lot of data that says these work very well. I get that, but here's some of the evidence. We as a society have been masking and social distancing and keeping our hands cleaner probably than ever. And all the viral transmissions we would expect over the last year and a half or so are dramatically down. We really didn't have a flu season for the first time in almost ever. And that's because folks were wearing masks. And I know it's frustrating. You hear, wear a mask, don't wear a mask if you're unvaccinated, don't wear a mask if you are vaccinated, wear it indoors, wear it outdoors. All of those recommendations have changed based on what the virus is doing. As it's increasing, as it's mutating, as we see more folks get sick, as we see folks who have been vaccinated, they're able to spread the disease. We know that now. They can get it. They can spread it. Now they're not nearly as likely to get sick and not nearly, as I said, as likely to die. But in fact, we are seeing transmission, particularly in those folks who are quite a ways from their vaccine date. So it makes sense to be careful. This disease is still killing people. And even if you don't know people that have died from the disease, many folks who get and recover from COVID do not recover completely. They have something called long COVID. They have exhaustion, they have mental fogginess, they have joint pains, they have other problems, including cardiac problems. that can be disabling. So it makes sense to be as careful as we can. If you're not concerned about yourself and your own health, and some folks are young and hardy and think, I don't have much risk. Those around you, including people you love, may have risk of getting sick. And even if recovered, may have risk of long COVID. We're seeing lots of that across our community. So we also agree with what the CDC is recommending. Our transmission rates have gone up dramatically. Delta is spreading everywhere. It is still producing death and disability across the country. And I believe the responsible thing to do, the loving thing to do for our friends and neighbors is to do everything we can to protect our community from transmission. And for me, that includes a mask, hand hygiene, and social distancing.
Thank you for that. And certainly we can all agree that we want to see our kids safe and healthy and attending school in person this year.
Yes.
And one of those layered mitigation strategies that will help that become a reality is the mask. So again, that strong recommendation coming from the health department and from Spectrum Health Lakeland as well. Thank you. So turning our attention now to some of the more recent news about vaccinations. Just earlier this week, the FDA granted that full approval to the Pfizer vaccine for those individuals age 16 and older, which is great news. This is a big step in the vaccination rollout and effort. Can you just share a little bit more, Dr. Cabaltica, on what this means for our vaccination efforts?
Well, it means that we finally have a vaccine that's been fully vetted, fully approved, that we've tracked all the side effects since it was first rolled out a little bit over 9 months ago, and have seen that it is highly effective. I mean, for a vaccine to be over 90%, 95% to 99% effective, that is astounding. But there was always a concern: are there side effects? Are there things that we haven't seen yet? And so I appreciate that the FDA was very careful in making sure that before they granted full approval, they checked all the vaccine adverse reactions that were reported to them. Many of those who got the vaccine were given the opportunity to sign up for that system that made it very easy for you to say, I've had this side effect, or this has happened. And anyone actually can do that. Doesn't need to be a physician or a nurse. So with the track record of millions of doses being given, the fact that we've been able to identify that, yes, with certain vaccines like J&J, there were a few cases of thrombotic complications or myocarditis in young adolescents that with the mRNA vaccines, but it's been vetted, and we know that those vaccinations are very rare, and so that these vaccines have stood the test of probably one of the most intensive monitoring campaigns held by the FDA in anyone's memory. And so we agree behind the science behind that. I know it's been the rapidity with which they have rolled this out has been almost unbelievable. I talked to one of the public commenters at one of our meetings saying that she totally understood that when the FDA just streamlined the whole phase 1, phase 2, phase 3 trials so that there was no daylight between one phase to the next, and that they were confident that they cut out all the delays that could be potentially found, that we now have a fully approved vaccine, and in an amazing short time without any shortcuts, really. So what this does not mean, though, is 12 to 15-year-olds. It's still under EUA. They're still doing due diligence to make sure that that any adverse reactions, any ill effects are going to be fully vetted, fully investigated before they say that, yes, it's coming out of EUA into approval. So we're not sure when that's going to happen. It's taken 9 months since the older adults were first enrolled. So we're hoping that it won't take as much time. But so for the 12 to 15-year-olds, it's still under EUA, meaning pass through phase 1, 2, and 3 trials. There are no obvious bad ill effects, but they want to be careful and monitor for any of those before they give final approval. But that still leaves those under 12 years old that there's still no vaccine that they're eligible for. And so there are studies ongoing to try to get those down to 5 or 6 years old. But it's not clear. It's not clear when that's going to happen. Hopefully Hopefully later this fall or winter, there'll be some EUAs, but we don't have any guarantees on that. As far as where we stand within the county, can say that we're so glad that 55% of those 12 years old and older have gotten at least one dose, and we're nearing 50. We're over 50% as far as fully vaccinated. So again, I would just strongly urge you that with this kind of monitoring going on for these vaccines, please go ahead and protect yourself, protect your loved ones. It's not only the little kids, but for the kids to see their grandparents as well, to minimize transmission to them. So if you can get the vaccine, please go ahead and do so. Protect those that are not eligible yet.
Absolutely, well said. Dr. Hamel, earlier last week, we actually saw the FDA and the CDC share some additional guidance on a third dose being needed for immunocompromised individuals. And then later, an announcement about a booster dose needed for all people who received that mRNA vaccine starting in late September, early October. Can you help break that down? What's the difference between these recommendations?
Sure. For those that are immunocompromised, what that means is you might not make antibodies as well as others. And a third dose helps you make more antibodies. Also, if you're immunocompromised, the disease tends to be much more difficult. So making sure you have enough antibodies is a good thing. That just means you're kind of completing the primary series. That's what you need to get that antibody level. A booster, on the other hand, is over time, we expect antibodies to wane. Now, when you first vaccinate, you don't necessarily know, is that going to be 6 months or a year and a half? You have to just wait and see. But we've seen some evidence that the antibodies are waning and a booster shot will likely be necessary. You can't get that today. You can't call and schedule that today, but stay tuned. You'll hear as we learn more and make plans for that booster, you'll learn when that's going to be available. Also, the companies making the vaccines and the scientists studying this disease recognize it's mutating. We may be in a situation where we need actually a little alteration of the vaccine to cover a new mutation. And the folks that are making this vaccine are prepared for that. And if we find the vaccines aren't working against new strains, that will be tragic, but there will be a response and we'll have, I'm sure before too many months goes by, they think they can do this within 90 days, we'll have a vaccine to cover those new strains as well. So stay tuned. We'll share more of that later. I just want to make a comment to those of you that are really anxious about getting a vaccine. Let me give you just a quick analogy. Some of you, some of us are afraid to get on airplanes. Most of us that are afraid to get on airplanes aren't afraid to get in cars. Well, as it turns out, a car ride anywhere has a greater chance of harming you or killing you than an airplane ride. Airplanes are in fact safer. And you can adjust that data any way you want. Driving is more dangerous than flying. But we recognize there's anxiety related to flying. I can tell you the vaccine is more safe than the disease, period. All the common side effects and many of the severe side effects that you see with the vaccination are much more severe with the disease. And you just can't escape that risk, in my view. You're either taking a small risk, a tiny risk with a vaccine, or a very substantial risk with a disease. Even the scary things, like Dr. Cabaltica talked about the myocarditis in young individuals. We have seen significant heart complications with the disease. We have seen deaths in children related to the virus. And the complications related to the vaccine tend to be short-lived and go away. And folks tend to recover completely. Not in every case, but tend to recover completely. So even those severe complications are more likely with the disease than the vaccine. So I understand the anxiety. I understand your concern, but there is no zero risk option. And the data suggests very, very clearly that it's much safer to take the vaccine than to take your chances with a disease.
Yes, and even in the more recent news stories we've heard about breakthrough cases, people who have been fully vaccinated and still contract the infection, that infection is significantly reduced.
Much
with
milder.
very much milder symptoms. So even if in that case, the vaccine is going to be beneficial. So Dr. Cabaltica, before we close, just want to open it up to you for any parting thoughts that you'd like to leave our listeners with today.
Just hearing Dr. Hamel speaking of those analogies kind of brought up one of the analogies I was trying to communicate with folks about, masking. Why is masking such an important thing? Well, when you're looking at the impact of other public safety, public health measures. So for example, seatbelts. No one argues about wearing seatbelts or putting kids in car seats because we know that it has reduced the deaths among children. And yet, because we have not seen years and years of data, there's a lot of debate about the mask. And I would urge you to consider that it's like that. It's basically just putting on a seatbelt for your kids when you send them off to school. You wouldn't send them off, you wouldn't drive them without a seatbelt. Well, I would urge you to consider it as the seatbelt as they go into school, so that they can stay in school. It's even as severe as some of the complications that we hear of, they are rare. But the thing that everyone, about 10,000 students in our county witnessed, quarantines are hard. And when they have to be shut out of school for 10, 14 days, and you can actually reduce those numbers then with wearing a mask. So I would just urge parents to consider that as a safety measure for the kids, as well as just giving kids a sense of, this is what I'm doing for the community. This is what I'm doing to love my neighbor, to protect their health as well as for me. And just again, the last thing I think is that we always do things better together than try and be the lone wolf. We can't, public health doesn't work that way. And as we consider what it means to love our neighbor, what it means to care for our community, doing everything you can to try to finally get through this pandemic, because we're better together. Divided we will fall, but united we will indeed stand. So let's stand together and do as many of these measures as we can.
Very well said. Dr. Hamel, open it up to you. Anything to add?
Can I just say amen? Would that be okay? Very nice, Doc. I just so much agree. We are in this together. And I know that some of us have different views. And we hold those views strongly. I get that. But we are in this together. This is a common enemy. It is taking lives in our community. It's not over yet. It is going to get worse before it gets better. And it's a time to hang together. It's a time to treat each other like friends and neighbors, help each other out. And hopefully down the road, by doing this together, we'll have fewer people that get very sick. And we certainly hope and pray that we'll have way fewer people that lose their lives. So thanks for tuning in. And thanks so much for being part of the effort to help keep our community safe.
Yes, thank you both for joining us today. And thank you for tuning in to this Facebook Live update on COVID-19 here in Berrien County. If you'd like more information about any of the things discussed today, you can check out Spectrum Health Lakeland's website, as well as the Berrien County Health Department's website. You can find more information on both of our Facebook pages as well. Thank you both so much.